But isn't this also then a changing of the medical model, not just on the patient side, but also on the medical side itself, the clinical side of a team that works together? Because if you have individuals, and that's how most integrative centers work, if you end up going to Dr. Smith rather than Dr. Adams, you're going to get a very different treatment plan. It'll, coincide differently. Different nurses may do things differently. I know where we work, it's very team-based. You don't get an individual practitioner, you get the team when you show up. And you do get that sort of model of everyone's on board on somebody's program of treatment that involves that patient, of course. But don't you think that needs to change also, where it's not so separatist and you have a model that's meeting groups with your own team and groups of kind of clinicians and experts, or shouldn't say experts, but also people that work on that side?
Well, Casper, I think one of the things that you and I have probably both seen is that the kind of patients that come into the clinic that you work with are not the middle of the bell curve of care, right? These are deeply multifactorial chronic illness where they've been everywhere else and they've gone to every other specialist and they end up there. And, the systems that will be built that to deal with that kind of population sounds like what you're talking about, where you have teams and they discuss and so forth. There's nothing more radically inefficient than a long doctor visit, than a whole team of doctors working on one case, right? That's even more radically resource inefficient. So, I think there is definitely a need for that. What you described is absolutely correct as far as the difference between the different clinics. I guess, in my estimation, the thing that bends the curve of costs, right? To come back to where we started, the thing that flattens the curve, everyone understands flattening the curve now, right? So if you want to flatten the curve of healthcare costs, what needs to happen? The middle of the bell curve of society that is currently pre-chronic illness or chronic illness needs to be well and healthy. And we need to have a large proportion of the country that is well, and then a smaller percentage that has a chronic illness, and then a very small group of people that will always be, probably because of environmental, issues, will be in that category that you're talking about. And so my plan I think I've spent the last 10 years trying to work out what you speaking. Like, one of the things that I saw, for instance, was you need to, in those kind of teams that you're talking about, you need to have a common language. In my estimation, functional medicine provides a common language for a chiropractor, an acupuncturist, a nurse practitioner, a dietitian, and a nutritionist, and a physician to work together as a team, because now they can identify with that specific patient, where is their function less, where can they build up the function, where should they prioritize their efforts. So that I did that, and I feel like that is, hopefully that is something that's happening in the minutiae, I guess, and that is relevant. I guess what I've really sort of moved my focus towards now is that middle of the bell curve, and trying to shift the standard of care without relying on doctors to, doctor entrepreneurs to lead, because ultimately I feel like physician entrepreneurship, it might be something that you could bet on in America, but in every other country around the world, it's a disaster, right? Only America has this history of private practice to such a degree, and it's moving away. And even in the one of the things the pandemic did is took another large chunk of doctors into employed roles. So, the relying on physician entrepreneurship to solve the problem, I don't think is the best plan. And so, what we're trying to do is trying to make it easy for whole health systems to adopt some form of health created medicine in a way that is profitable and scalable. I don't know if it's the right plan, but I'm just kind of following the thread.